Okay, so we all know that the United States is the only industrialized country in the world that does not have a universal healthcare system in place. Even many middle income and developing countries have universal systems, some of which actually perform quite well and have really good outcomes considering their income level. Perhaps because of this feeling of being the only one left behind the curve, Americans who talk about universal healthcare tend to just sort of lump the rest of the world together and act as though it's all the same, more or less. And this is really not the case. As I tried to make clear in my previous video, pretty much any universal system has major economic advantages over the current American system, but there are still plenty of differences between universal systems, and some of them do some things better than others. Today I'm going to try to give a very brief overview of a few different universal systems in different countries and to talk about what makes them different. Because understanding these differences can be very important when it comes to deciding what kind of system we want to put in place in the US. All right, our first stops on this healthcare tour are going to be to the countries that Americans usually bring up the most, and that's Canada and the UK. In these countries, as well as other former British colonies like Australia and New Zealand, the healthcare industry is treated in large part as an arm of the government. The industry is designed around a series of public hospitals which are funded by the government and simply just don't charge patients for care. So healthcare is treated as a public service, kind of like the police. The costs of the system are paid by the government as a general expense, often without dedicated funding or a protected guaranteed budget. And this means that insurance for the general healthcare needs essentially doesn't exist. It's not government insurance, it's simply no insurance, and in its place, a national health service, hence the name of the system in the UK. This system is basically a government monopoly on healthcare, which has some upsides and some downsides. In the UK, each nation, that is England, Scotland, Wales, and Northern Ireland, has its own system, and all management and negotiations are handled at that national level. In Canada, the responsibility for management and payment is shared between the federal government and the provincial governments. The biggest upside, aside from universal coverage, of course, is that government is also the only buyer of medical services, equipment, and drugs. Being the only buyer in a country gives you huge bargaining power. Essentially, doctors, equipment suppliers, and drug manufacturers have to accept whatever price you decide to pay them, or they simply can't get paid at all. This helps to keep excessive profits down and lower the amount that the country has to pay for healthcare overall without necessarily lowering the quality of care. Now that sounds great, but what's the downside? Well, the downside is politics. Governments change over time, and so do their priorities for spending and taxation. If a political party comes into power that thinks, for ideological reasons, that the government spends too much on healthcare, well, they can very easily suffocate the system by cutting its funding or refusing to increase the funding when that may be necessary. This can lead to a loss of efficiency, which can then be twisted into a political argument to weaken the system or scrap it entirely. This has actually happened in Canada in the last 25 to 30 years, where a reduction in overall funding in the 90s has led to the introduction of more private for-profit hospitals and a need for more supplementary private insurance in recent years. These changes have also led to much higher out-of-pocket costs in Canada and have been a big part of the increased wait times for which they're often criticized in the US debate. Alternatively, if healthcare is paid out of the general government funds, a political party might increase taxes, telling the people that this is for the healthcare system, but then instead directing extra spending towards something entirely different. This is why the UK has some troubles funding its own system, since the people will only support some tax increases if the money is guaranteed to go towards healthcare and nothing else. But the government is generally unwilling to make this guarantee. So this tension has made it difficult for the government to politically justify increasing funding to the system, which has held it back from meeting modern needs and from improving the quality of care overall. Now, English-speaking countries are not the only ones who approach healthcare in this way. You can find these kinds of national health service systems in countries around the world, especially in poorer countries, but also in a number of wealthier and more developed countries. Nordic countries, for example, operate in a similar manner, but generally have the organization of healthcare managed on a much smaller scale, either by regional, county, or even city governments. This strategy is more responsive to the needs of the patients, but it can result in major regional differences within the country, which can make it difficult to ensure that everyone in every region is actually getting the quality care that they need. Nordic countries also tend to be a bit more accepting of out-of-pocket costs, with out-of-pocket expenditures accounting for about 18% of healthcare costs in Iceland, and Norwegians paying roughly $250 deductible each year before the national healthcare coverage actually kicks in, as just a couple examples. These kinds of universal single-payer Medicare-like systems tend to be the focus of the debate in the US, but it's not the only option. Another common type of system for universal health coverage is what can be referred to generally as national health insurance. This is what we find in countries like Germany and France and Japan and South Korea. The idea behind national health insurance is that there is still an insurance company involved, but it's non-profit, heavily regulated. Everyone has access to it, and the quality and extent of coverage is universally guaranteed and negotiated at the national level. Another important distinction between these systems and the US system is that an individual's contribution to the insurance funds are determined according to a principle of collectivity, which means that what you pay is not about how much it costs to insure you individually, but instead it's based on a combination of the average cost of insuring people throughout the whole system and your personal income or ability to pay. In other words, insurance premiums are set at a percentage of income, which is the same for everybody, but that percentage might change over time depending on how expensive it is to actually provide healthcare to the whole country. These systems can be single-payer, as is the case in South Korea, but most are multi-payer, with people having the choice between a number of different funds that are all offering the same guaranteed set of coverage at the same price, and usually they compete with each other in different ways. The major distinction between these systems and the Medicare for All style systems is that while care is guaranteed and enforced by the government, the actual payment and negotiations about prices, quality, and the extent of coverage are handled by institutions that are accountable to the government, but bureaucratically and managerially independent. For example, the German government requires that the insurance covers everything that is necessary, sufficient, appropriate, and economical. But the actual decisions about what qualifies according to these principles are handled by an independent committee, which is established by government decree and is legally supervised by the government, but is chaired by a group of legal representatives of associations for the interests of the insurance funds, the hospitals, and the private practices of doctors and dentists, with some non-voting advisory members representing the patients. There is also another independent academic organization which determines what services and treatments are necessary and sufficient, kind of like the FDA in the US, but more independent. And that organization advises this committee. Now, I know this sounds kind of complicated, but what it does is it allows the prices of treatment and extent of coverage to be negotiated in a way that balances the needs of all these competing interests without direct influence from politicians, while also being accountable to the ethical requirements set by the government and the science behind what those ethical requirements actually mean practically. Additionally, the independence of insurance funds means that the government never touches the money for healthcare. So healthcare spending is not a part of the government budget and is therefore not a viable target if and when political forces favor budget cuts. In this way, these systems are kind of a perfect balance between government oversight and the insulation of critical systems from the shifting winds of politics. All of the countries with national health insurance systems have roughly similar systems for managing everything, and these national organized venues for negotiations, combined with some government requirements and price controls, are what keep the costs down and ensure that every patient can see any doctor they want. These national health insurance systems also usually allow some space for private, for-profit health insurance in different ways. Germany, where I currently live, has for-profit insurance companies which cover a small minority of the population, and people can choose to use them instead of the national statutory system. These private companies operate very much like American insurance companies in many ways, and they offer more coverage than the statutory system does. After all, they wouldn't be allowed to offer less. But the extremes seen in the American system are held back, since they have to compete still with the robust and comprehensive nature of the statutory system. Many Germans do complain that this leads to a two-tiered healthcare system, which is true to a certain extent, but the generous requirements for the statutory system mean that most people are generally satisfied with the lower tier, and the upper tier is largely just a luxury. In France and Japan, very much unlike Germany, the national health insurance only pays for about 70% of most healthcare costs, up to 100% in the case that you need longer term or more expensive care. So the rest is either covered out of pocket or by supplementary private insurance funds. In France, these are mostly all non-profit and mutual funds, kind of like credit unions, but for health insurance. The costs of these are quite low as 30 to 40 euro a month, but the more expensive ones, like 1 to 200 euro per month, they'll also pay for things like childcare and house cleaning services if you are stuck in the hospital. Every company in France is required to offer the option of such a supplementary plan to their workers, where the employer pays at least 50% of the cost. In Japan, the supplementary plans are not really designed to pay the remaining healthcare costs, but instead they grew out of the life insurance industry and basically give you supplementary income if you have to be hospitalized. It's important to point out that in all of these cases, the private insurance market is not truly in competition with the national insurance system, as some Democratic politicians suggest we do in the US, but instead, it was introduced later as a way to cover additional things beyond what was already determined to be quality comprehensive healthcare and was already provided for everyone. It's worth pointing out also that even though countries like France and Japan do leave a significant portion of healthcare costs for the individual to pay, the total costs are heavily controlled by the government, and they have yearly caps on how much you have to pay until insurance will cover 100% of all of your costs for the rest of the year. And these caps are still extremely low compared to what people pay out of pocket in the US. Now, all of these universal systems provide care to everyone without ruining anyone financially. And they all keep costs low, paying much less per capita on healthcare than the US does, while still achieving similar or better health outcomes. According to the WHO, all of the countries that I've mentioned today, with the exceptions of South Korea and New Zealand, are ranked better than the US in terms of the quality of the health system. France is consistently rated #1 in the world. If you can't tell by the way I've been talking about it, I personally think that national health insurance systems, like what you find in Germany and France, are better. They provide universal coverage that is not based on your ability to pay, and they are more resistant to political forces that can hurt the industry's ability to function and improve itself. It is frustrating for me, then, that these types of systems are rarely, if ever, considered in the debate about universal healthcare in the US, and I think that's just because a lot of people don't know about them. As I said at the beginning, any universal healthcare system would be a huge improvement over the current American system. But I think it's important for people to be aware of the different options that exist out there so that they can have a better discussion about it. So I hope you've learned something and can come away from this with something new to think about. Until next time.